I will talk about different abnormal shapes of the head. Okay, different abnormal shapes of the head. So you can have scaphocephaly, trigonocephaly. So this trigono, I'm suspecting a triangle, so the head is probably like a three shaped. Oh, sorry, I didn't pick this. Okay. You can have the posterior plagiocephaly. You can also have the anterior plagiocephaly. There are different other anomalies of the head, but I picked these four. Let me discuss them because the names might be too long. I might actually exceed the normal 100 letters that YouTube will allow for a heading. So we spoke about trigonocephaly, we spoke about scaphocephaly, we spoke about an- anterior plagiocephaly, we spoke about the posterior plagiocephaly. So you can see other ones like brachycephaly. This one's different lecture, you know. All right, so fine. Can we move? Okay, so all of them, they are forms of what? Abnormal skull formations. So the skull is not formed right. Of course, somebody is born with it. Okay, so let's talk about each one of them. Scaphocephaly. This one is also known as what? Sagittal craniosynostosis. Craniosynostosis. Okay. See, the head is at the front appears normal, but at the back is protruding too much. Let's look at this other picture. Well, the front too could protrude, but the front is looking relatively normal than the back is too much. So there's a premature, what's it called? Premature closure of the sagittal sutures. Normally these lines on the skull, they should be open so that your brain is getting big, 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 fine, to a particular level before they close. But they close too early. Okay? Appearance, you have a long, narrow, boat-shaped skull. Okay? Forehead and back of the head may protrude. But the forehead is looking fine relative to the back, you know. So that's what we got. Treatment is okay, there's raised intracranial pressure and might be compressing the brain. So the person is having a lot of developmental delays. Your mates are walking, you have not started walking. Your mates are talking, you have not started talking. Yes. So treatment is what? Endoscopic strip craniectomy, yeah, cranial valve remodeling, spring assisted surgery. So we have the trigonocephaly. So trigonocephaly is this what we got here. Okay. So trigonocephaly is what? Is a premature closure of the metopic sutures. So you have the head looking like a triangle, just like I told you guys from the word triangle. So it's looking like a triangle, closely spaced eyes. Okay, hypotelorism. And there's increased intracranial pressure. The person will also have the same issues, developmental delays. Surgery is what? Endoscopic assisted or open cranial valve remodeling. Okay. They'll have the posterior plagiocephaly. What's the difference between the anterior plagiocephaly and the posterior plagiocephaly? See, posterior one, right? One side is shooting. Poof. The anterior one side is shooting, but it's at the front. The posterior one side is shooting, but it's at the back. So that's what we got. So they have the two types. Could be positional plagiocephaly, where there's flattening of the back of the head, because you are always keeping the baby on that one side of the head. So you always turn your baby. Okay, it's benign. It will go away. Therefore, synostotic posterior plagiocephaly, it's flattening, occipital flattening. Okay, that one is due to lambdoid, premature closure of the lambdoid suture. Well, the sutures at the back, and it's an issue. It will not go away. Anterior plagiocephaly, there's the issues at the front now. So the coronal suture, not this is the head. Okay, this is the skull. Okay, the sutures at the back are the lambdoid. The one at the front is the coronal. So if the issue occurs at the front, you have the cranial, the anterior Plagiocephaly. So there's flattened forehead on one side, raised eye socket, known as the harlequin eye, you know. Then risks, there's oculomotor anomalies, strabismus, facial maldevelopment. So treatment is surgical release and also remodeling of the frontal bone and the orbit.